Good afternoon. COVID-19. What is it? Coronavirus. From this point on, we have been quarantined and we are in a state of emergency. We have an invisible enemy, as Trump said. Fear is the problem at this moment. It's causing disarray, mayhem, panic buying, just driving people crazy because they don't know what to do. With carefully improved media placement, I think we can disengage panic, provide safety measures as steps to wash your hands, what to do, how far to be away from people, ways to prevent, the illness spreading. The best way to prevent the illness is to avoid being exposed to the virus, which is common sense. The virus spreads mainly from person to person, contact, airborne, coughing, ways to cough. You cough in your elbow, not your hands. When it's airborne, they are in droplets and they stay floating for about 30 minutes. We can take steps to protect yourself. So when you wash your hands, make sure you use soap. Make sure you sing the ABCs to wash your hands for that long. Avoid touching your eyes. Definitely avoid touching your face. Face masks, they do work for spreading, not like saving us. So if you do have the virus, you wear the mask because you don't want to spread. Gloves, of course, you need to wear disposable gloves. You touch something, get rid of them, get new gloves. That's how you want to do things. If you're sick, stay home. You don't have to put people in danger because you are negligent and want to leave your house. You must frequently clean and disinfect any surfaces daily. Doesn't matter if you're indoors, you just clean everything. This would minimize the risk of getting sick. Make sure you use bleach, which is an amazing cleaning substance. If you don't have bleach, alcohol is a good substitute. If you are sick, most important thing, like I said, do not leave your house. Stay home. Stay in touch with your doctor. Make sure you know what to do. Avoid public transportation. Avoid anything. Don't leave. If you're not living with people at home, separate from your family, from whoever's in your house. Isolate yourself. It's the best way to keep without spreading. Make sure they're doing a study. Make sure you have no contact with animals because it's possible you could spread it to your dog. And if you are sick, wear the face mask. Make sure you monitor your symptoms. I mean that as the common symptoms are like the cold or like the flu, but more severe. So make sure you check your temperature for the fever, take the proper medication for that. Don't take any Advil, any painkillers like that. They don't work. Motrin is the only thing that works. Tylenol doesn't work. The only reason you should leave your house if you are having trouble breathing. This virus attacks your lungs. It's pulmonary, which means your lungs basically stop working. Make sure you're in contact with your doctor if you are sick. For those people that are isolated, there is a 7-day window that you have to wait for your symptoms to pass. If you haven't had a fever for at least 72 hours, and like I said, 7 days, you should be able to leave. Unless you want to get tested, you need to test yourself at a medical center, and you must have 2 negative testings 24 hours apart, which means 7 days plus 2 more days. And that's improving in your symptoms of coughing, shortness of breath, really no fevers left. And you just have to make sure that, you don't spread things. Because we want to finish this virus. We want to get better. And here's to us coming back in this world, being able to leave our houses. Please be safe. Take care.